A lot of people think low blood pressure is a sign of good health, and for some, it is. But that's not always the case. If your blood pressure drops too low, especially with symptoms like dizziness, fainting, or fatigue, it could be a sign of an underlying health issue. So what exactly counts as low blood pressure? Generally, anything below 90/60 is considered low. But here's the thing. What's low for one person might feel perfectly normal for someone else. In this video, we'll break down the causes, the warning signs to watch for, and when low blood pressure becomes a serious concern. Low blood pressure, also called hypotension, happens when the pressure of your blood against the artery walls drops too low. Some people have low blood pressure and feel just fine. Others may experience symptoms like dizziness, fatigue, or even fainting. And in more serious cases, low blood pressure can actually be life-threatening. That's why it's important to figure out what's causing it, so it can be treated if needed. Now let's move on to one common reason your blood pressure might suddenly drop: a simple change in position. This usually happens when you go from sitting or lying down to standing up. When you stand up quickly, gravity pulls blood down into your legs. That briefly reduces blood flow to your brain, so your body needs a moment to catch up and push it back up. That temporary drop in pressure is called postural hypotension, or orthostatic hypotension. It can be triggered by things like dehydration, extended bed rest, pregnancy, certain health conditions, or even some medications. And it's something we tend to see more often in older adults. Next up is something called neurally mediated hypotension, also known as reflex syncope. It's more common in kids, teens, and young adults. According to the Mayo Clinic, it happens when there's a miscommunication between the brain and the heart. Just standing for too long can trigger it. When that happens, your heart rate and blood pressure suddenly drop, which reduces blood flow to your brain. And that can make you feel dizzy or even cause you to faint. Another possible cause of low blood pressure is something called postprandial hypotension. That simply means a drop in blood pressure that happens after eating, usually within 1 to 2 hours. It mostly affects older adults, especially those with high blood pressure or conditions like Parkinson's disease. Here's what really happens. After you eat, your body sends extra blood to your stomach and intestines to help with digestion. In healthy individuals, after eating, the heart rate increases and the rest of the blood vessels tighten to keep pressure stable. But in some people, particularly older adults, or those with Parkinson's, diabetes, or other autonomic nervous system issues, this adjustment doesn't work the way it should. As a result, blood pressure falls, less blood reaches the brain, and that's when you might feel dizzy, or even faint. Another common cause of low blood pressure is medication. Certain drugs, especially ones for the heart, can lower your blood pressure more than needed. This includes diuretics or water pills, medications for high blood pressure, and drugs used during surgery. Painkillers like opioids, antidepressants, and anti-anxiety meds can also affect how your body regulates pressure. And it doesn't stop there. People with Parkinson's disease often take medications that can lead to low blood pressure, especially when standing up. Even some over-the-counter medications or combinations of drugs can make the effect worse. So if you're feeling dizzy or lightheaded, especially after standing, and you're on any of these medications, it might be time to talk to your doctor. Another possible cause of low blood pressure is heart problems. Sometimes the heart just isn't pumping enough blood to meet your body's needs. This can happen if there's a problem with one of the heart valves, or if your heart rate is too slow. When that happens, blood pressure can drop, and you might feel weak, dizzy, or even lightheaded. Nutritional deficiencies can also lead to low blood pressure. For example, a lack of vitamin B12, iron, or folic acid can cause anemia, meaning your body doesn't have enough healthy red blood cells to carry oxygen. And when that happens, blood pressure can drop. Another cause is a severe allergic reaction. When someone is highly sensitive to things like certain foods, medications, or even bee stings, It can trigger a rapid drop in blood pressure, a condition known as anaphylaxis. Hormonal issues can also bring your blood pressure down. Things like low blood sugar, diabetes, and underactive thyroid or Addison's disease can all affect how your body controls blood pressure, leading to dizziness, fatigue, or even fainting. Low blood pressure can also happen during pregnancy. When you're pregnant, your circulatory system expands quickly to support your growing baby. Because of that, it's completely normal for your blood pressure to drop, especially during the first 24 weeks. Another cause of low blood pressure is a serious infection. One of the most dangerous examples is septic shock, and it's a true medical emergency. When bacteria from an infection enter your bloodstream, they release toxins. These toxins cause your blood vessels to widen and leak, leading to dangerously low blood flow. If the blood flow gets too low, your organs and tissues might not get the oxygen they need, and that can lead to serious, even life-threatening damage. Low blood pressure can happen for many reasons, including when your body doesn't have enough blood or fluids to keep things moving. Whether it's from dehydration, heavy bleeding, or internal injuries, a sudden drop in blood volume can cause your pressure to drops, leaving you feeling weak, dizzy, or even faint. Understanding what's behind low blood pressure is the first step to managing it and taking better care of your health. If you found this video helpful, give it a thumbs up and leave a comment below. And don't forget to subscribe to Blood Pressure Healthcare for more tips on managing and maintaining healthy blood pressure. Stay healthy, and we'll see you in the next video.